So let's talk about the lateral view of the skull. The anterior part of the side of the skull is made up of the frontal bone you can see here, and the frontal bone will communicate with the parietal bone through the coronal suture. And the parietal bone will communicate with the parietal bone of the other side through the sagittal suture, and the parietal bone will communicate with the occipital bone through the lambdoid suture, which is present right behind. Okay, so this is about it. So now let's talk more deeply about the side of the skull. So what do you see in the side of the skull? So for that, I have a mnemonic for you guys. Here you can see STO. So S represents the greater wing of the sphenoid, which is just beside the temporal bone. So this is basically the greater wing of the sphenoid, which is present here, and it is beside the temporal bone, which is here. Okay. And along with that, we have an O, which is the squamous part of the occipital bone. The squamous part of the occipital bone is also going to lie right here. Okay. Now let's talk about the further bones of the temporal bone. So what are the further parts of the temporal bone? So we have a squamous part, okay, and we have a tympanic part, a zygomatic, styloid, and mastoid part. So first of all, let's talk about the mastoid part. This is the mastoid part, which is a part of the temporal bone. So the temporal bone has a mastoid process, and it has a squamous process and a tympanic, or the ear hole, which you can see right here. This is the squamous temporal part. The zygomatic process, and also the styloid process. So the styloid process is here, you can see a conical projection. This is the styloid process. Okay. The thinnest part of the side of the skull is going to be right here, which is the pterion process. So what is the significance of the pterion process? If someone gives you a blow on the lateral side of the face, then the pterion bone is most likely to get injured. Okay. Why is it so important? Because it overlies the anterior part of the middle meningeal artery along with the middle meningeal vein. So now let's talk about the superior and inferior temporal lines. So this is it is actually very thin thing. So basically here you can see the superior and inferior temporal lines. So what is the significance of these temporal lines? Below the inferior temporal line, the temporal fossa is present. Temporal fossa is present just below the inferior temporal line, and also below the inferior temporal crest on the greater wing of the sphenoid. Okay. Now let's talk about something else, which is something internal. Now let's talk about a fissure. So what is this fissure called? And can we see it here? No, it is kind of an internal fissure. It is basically called the pterygomaxillary fissure, or you can also call it TMF in short. Okay, it is present between the pterygoid of the sphenoid and the back of the maxilla. This is the pterygomaxillary fissure. So now let's talk about the pterygopalatine fossa, which is the TPF. So this is the TMF, this is the TPF. Pterygopalatine fossa. So now let's talk about the boundaries of the pterygopalatine fossa. So what is an important way to learn the boundaries of the pterygopalatine fossa? So superiorly, laterally, anteriorly, and medially, right? So I have written these for you: SLAM, and you can also memorize CION. Okay, so S for the superior, L for the lateral, A for the anterior, and M for the medial boundary. So here we have, on the superior side, we have something that starts with a C. We have the cranial cavity, as you know. And on the medial side, something that starts with an N. We have the nasal cavity. It goes into the sphenopalatine foramen. And anteriorly, we have the intraorbital fissure, anteriorly with an O for orbit. And laterally, we have the intratemporal fossa. So now let's revise it. SLAM is for superior, lateral, anterior, and medial boundary. And what do we have? Superiorly, we have the cranial cavity. Laterally, we have the intratemporal fossa. Anteriorly, we have the intraorbital fissure, and medially, we have the nasal cavity.